Hello, I'm Dr. Cantu with League City Spine and Injury, and I'm going to tell you a bit about our office. In our office, we do practice what is called corrective care. So it's not pain-based chiropractic care or symptom-based chiropractic care, it is corrective care, and I'll tell you what that means. With corrective care, we give recommendations and we render treatment based on correcting the cause of a patient's problem. So we work on correcting and improving a person's posture, we make sure that the spine is moving properly, and then after that we maintain a healthy spine and nerve system. And with corrective care, it is very important that we x-ray everybody, with very few exceptions. And the x-rays tell us a lot. There's a small safety component to why we x-ray. So the safety part of the x-rays is we've got to make sure that there's nothing like a fracture, a tumor, or an infection. Those are rare, but we do have to keep that in mind. And also with the x-rays, it is something that lets us give a patient a proper prognosis. In other words, we will know the true health of a patient's spine. And to expound on that a little bit, the x-rays will also let us know if there's damage in a person's spine in the form of arthritis. And when I say arthritis, I know most people are thinking that only happens to elderly people or people who are older. You're thinking 60 or 70 or 80-year-olds, and there certainly is a correlation there. But doing this for 15 years, I can tell you we regularly see arthritis on a patient's x-rays when a patient is in their 40s or even younger. We do see it in patients as young as 25 years old. So what this damage in the form of arthritis tells us is really the root of a person's problem and when the actual cause of the problem actually started. So here's an example of that. Say we have a patient who comes into our office, and just for an example, they have lower back pain, and this patient might only be in pain for a couple of weeks or a couple of months, and they tend to think that because they've only been in pain for a couple of weeks or a couple of months, that the cause of their problem has only been there for a couple of weeks or a couple of months, and the x-rays do tell us exactly when that problem started. So sometimes the cause has only been there for a couple of weeks or a couple of months. Sometimes, and I'd say the majority of times, it was actually something that happened years or decades ago, like a car accident, a sports injury, or jumping off a roof that happened a long time ago, where the patient is not even linking that trauma to the pain that they're having now. So the x-rays are important for that reason right there. So the opposite of corrective care would be what we call pain-based chiropractic or symptom-based chiropractic. And this is something that, from a philosophical standpoint, I completely disagree with. So the pain-based chiropractor will tend to give recommendations and tend to give treatment based on a patient's symptoms. And I don't agree with that because it doesn't address the cause of the patient's problem. And pain-based chiropractors typically do not x-ray their patients. And that's not really a safety issue, believe it or not. I know that sounds contradictory, but watch this right here. Any competent chiropractor who does an exam on a patient can safely adjust that patient without any sort of safety issues. It is a very safe procedure, the chiropractic adjustment is, but that's not the reason why I don't agree with not x-raying. The reason why I disagree with not x-raying is because that chiropractor does not know the true health of the patient's spine, therefore cannot give them a proper prognosis or their proper prospects for healing. And the patient, they don't know where they're at when they start. They don't know truly and objectively how healthy their spine is, and they don't know if they're getting any sort of structural or posture correction over time. They're strictly judging the effectiveness of the treatment based on how they're feeling. And here's one thing that I do know: if a pain-based chiropractor adjusts a patient when they're in pain, releases that patient when they're out of pain, but does not correct the cause of the problem, the pain is just going to keep coming back. So if you have any questions whatsoever on chiropractic care, pain-based versus corrective care, feel free to give us a call. I look forward to talking to you very soon.